What's good? I'm Ross. Welcome to My Wellness Dojo. As we all know, knee pain can be complicated. There's a number of things that go into what actually bothers your knee and also what makes it feel better, what you should do, what you shouldn't do, depending on where the pain is. But first, one of the most important things I would suggest is to do some stretching. So you're going to A, stretch, and B, it's a diagnostic test to see where you are tight and what you need to work on. So starting from the ground up, which I think is always best, especially when looking at the knees and hips, make sure you are stretching your calves both ways. And I've done a different video on how to keep your calves in good shape and how it addresses plantar fasciitis, which you can check out. But quickly, there are two ways to stretch your calf. One is with your leg straight. One is with your knee bent. Okay, so you can do that here. I'm going to get into a couple of other ones there. So your stretch diagnosis should be comprehensive. Right side, left side. Right side, left side. So first you can go ahead and take that knee, bring that hip forward, and hold that there. Make sure, as I've seen in other videos, if your leg is not straight, it's going to jack your hip up. So use a straight line, put that foot down, and bring that hip forward in line with that back leg. If you feel like it, take this over. Next, stretch. Again, you're looking for how the left side feels against the right. Let's look at the other side. So we'll take that knee, forward, hips stay tall, and I'm here. Then I'll come down here. Opening up that glute, how does that side feel? Right? Switch sides, right side to left side. I just felt my back crack, how does that side feel? Then we're going to go ahead and staple that down, reach it back. You're going to stretch the front of that leg, which can also help with your shin splints, that tibialis anterior, by stapling that hand down, reaching your butt back. For a couple others that are a little more advanced from this position, you can plant that hand. You can put your hand on your knee and turn. I'm trying to look over my shoulder while having my hand on my knee. Same thing other side. I'm going to push here, inhale, exhale, push, turn my chest to face over that way. Right? Then when I get down to here, before I even start, what am I going to do? I'm going to flex that foot towards my knee. I'm going to flex that foot towards my knee so that I'm not bent over and I'm just doing this and I'm not stretching at all. So you're really making that flush, making sure that these aren't rotated asymmetrically. So first, you can go ahead and walk those hands down, right down the middle. Inhale, exhale, let those hands go. So right here, you can start to feel which side is one hamstring tighter than the other. Am I getting different sensations here or here? If you feel more of a sensation on one side and it's tighter, now you know I'm going to spend a bit more on the left side, on that left side hamstring, for instance. So you're doing exactly the same thing, left, right, you're pivoting. So I'm here. If you can, grab that hand and then that little space in your bicep and kind of pull a little bit. If you can't reach, don't worry, you can also go here and do the same thing. Keep that foot flexed. Inhale, exhale, bring your chest towards your toe. How does that feel? Take my 30 seconds here. Push myself off. Same thing on the other side. You can also do it this way. Go ahead and wrap that foot. Pull a little bit with your back, so you're pulling a little bit. Inhale. Put it right there on my elbow hole and my bicep. And as I exhale, take it down a little bit. And I really get a good stretch on that calf. So ideally you're doing it symmetrically both sides. I just wanted to show both. So now I'm seeing how this feels compared to this. I was here, now I'm here. What I can also do from here, a little bit of a pivot, keeping that leg flexed. I can put my hands down, bring my chest about a 45-degree angle from my feet, bring this foot up for a better position, and just bring my chest towards the ground. Feels really tight. Same thing on the other side, right? I'm going to compare both sides. Okay. You're going to start to feel and see where and which side you're tight. You can also come down on your elbow, keeping that leg locked out for this stretch. That foot flexed. Come down to the elbows. You can see how far you can turn your body. So you notice all of this anatomy we're stretching here, here, here. Hip flexor, seeing how tight the hips are on the T-band, they're all around that knee, right? So what area haven't we checked out first? We've done here, we've done here, we've done the calves, we did the tibialis anterior. We didn't do the groin, right? Because think about it. You know, if you're experiencing knee pain, let's say you're experiencing medial knee pain on the inside. In general, what that's going to be is your muscles are tight here, probably, and they're weaker here. So when you stand, your knee is kind of compensating this way and opening up that joint and causing you some instability or pain. So a good way to stretch the groin. People like that butterfly stretch. Honestly, I'm not a fan. I don't want to sit here using my biceps to stretch my groin. Does that make any sense? Let gravity do the work. So a couple ways I like to do that. And again, if you have a back issue, go at this lightly, which I've probably shown this once or twice before. My knees are going to be about shoulder width apart. And this might be enough for most people. You go on your elbows. You can stay here. This might be really intense. If it's not enough, take your elbows and just relax. You can slide those knees out a bit more. Again, that's probably enough for most people. If you want to get into it a little deeper of a diagnostic, a little more complex motion, you can walk those hands to your left, and then I'm imagining I'm bringing that hip towards the ground. I'm not really going to move a whole lot, but I'm out here. I'm going to bring that hip towards the ground. I'm pressing through this way. So I'm activating this, and I'm stretching against it, so it's more of an active stretch to open up that hip, which is very powerful. So I'm here, pushing. Check the middle. I'm here with that left side, pushing. Boom. Or I could even come here and thread the needle, put my head down, take that hand, opening up my chest towards the ceiling, right? How does that feel here and here? Try the other side. Thread the needle, boom. Open up that arm, touch, open up my chest. How does that feel on this side? Right? So which groin is tighter? Which side of my back is tighter? Where do you feel better, worse, more flexible? So you start to get an idea, if you're not doing something diagnostic, of what you really need and what you should be looking for. Just becoming, developing a better kinesthetic or body awareness is going to help you to diagnose these little things and be aware what you are doing and what you're not doing, especially when it comes to stretching. Don't forget to check out these other videos related to your knee pain and your back pain. I'm Ross, aka Jude Jackman. This is my Wellness Dojo. Don't forget to make it your Wellness Dojo and smash that bell and go ahead and subscribe for more awesome.